Yes. So it is live now. Please start.
Okay. Hi, good evening, everyone, and
Good
welcome to the session of Postpartum Depression, How to Overcome. And we are going to discuss the essential strategies and the best practices for successful postpartum. As the name suggests, it's a postpartum depression. So it is found in new moms, the child of 0 to 2 year of age. And we will discuss the today we are going to discuss about the symptoms, about what practices can be done, and this is what this whole session is all about. Now, what is depression? It's a mental condition where a new mom experiences multiple changes psychologically, emotionally. And why it happens nowadays, it is very common because so much of societal pressure, so much of balancing their personal and professional lives, expectations. So we are going to discuss all. And before beginning the session, I would like to thank those who have logged in. You could be anywhere else, but you chose to be here and you want to know about the postpartum depression. And this session is not only for the new moms, it is for everybody who wants to know that how it is impacting a new mom's life. And if you're watching this or you will watch it later on, I request that share it with somebody in your life, somebody who is dealing with depression or mood swings. So I'm beginning the session. Welcome. And it's a small video where everybody can relate with their child. And if you are expecting mom, you can manifest that how my postpartum will be with my child.
साथ मेरे है ना ढूंढते तेरी गली मुझको घर मिला आबुदाना तेरा हाथ मेरे है ना ढूंढते तेरा खुदा मुझको रब मिला तू जो मिला लो हो गया मैं काबिल तू जो मिला तो हो गया सब हासिल तू जो मिला आसान हुई मुश्किल क्योंकि तू धड़कन मैं दिल
I hope you like this video. Now, mother. Today, I want all of you, those who are watching, that remember that what our mothers have done for us. She is a mentor, she's a manager, she's optimist, organizer, she's a teacher, she's somebody who is trustworthy, she's a healer, a homemaker, empathetic, encourager, a role model, and a reliable person in our life. I request those who are attending the session, type in the chat box, are you a new mom? Are you a preteen mom? Adolescent child mom? Adult child mom? First time mom? Second time mom? Or just a mom? So that we know that who all are attending the session. I got that. Now in today's session, we are going to cover what is the difference between postpartum depression, baby blues, what are the symptoms of postpartum depression, what treatment is given, how to overcome this phase, and actions that can be taken to come out of this phase powerfully. Today, I am going to share my short story. I will not take much time. I was not different. I think if you can relate, मैं ही हूँ. I'm there in the picture, but it's 22-year-old picture. I was not different, doing everything what I can do. I left my job. I was giving 100% to my both the children. And after having my second child, after few months, I went into depression. I was doing everything, managing home, preparing them for school, playing with them, handling relationships. But deep inside, I was alone. I don't know how to express my feelings, and I always being a submissive woman, submissive wife, and this is what I have been taught. बर्दाश्त कर लो, सह लो, but बोलो मत. Now today, I'm sharing this that there is a difference between baby blues and postpartum depression. Every woman after having a baby goes through baby blues. There are sad feelings that happens with everyone. There is worry, anxiety, loss of appetite, and these symptoms may be last for 3 days or a week. Worried about their future, when will I resume my normal routine? Sleep deprivation because there is change in the sleep pattern. Hormonal changes, and hormonal changes happens, but it doesn't impact much. But when we are talking about postpartum depression, there is mood disorder that affects a woman soon after the childbirth or within a year of childbirth, same which happened with me. Overwhelmed, stressed, loss of appetite, hating a child, or suicidal thoughts or attempt, which you can relate with any other depression symptoms. And these symptoms extend from 2-3 days to 2 weeks or so. So if a simple sadness, we say that the person doesn't involve in the same activities which they were enjoying before, but it lasts more than 2 weeks, then it's a red flag. And it seems beyond worry, obsession, checking baby again and again, cribbing, crying a lot. And the women with the depression history are always at risk. Not able to sleep, try get a time to sleep, but not able to sleep. Disconnected with child, with self, with the family, and even with the husband. Doesn't want to talk. There is a drop in estrogen and progesterone level. Now, the woman who is dealing with postpartum depression, she doesn't know that I am dealing with this. Now, I prepared a checklist which I will share after the session in the WhatsApp group. This can be shared with any new mom. This can be shared with expecting moms, and they can share it with their family members. That if in case she's showing these symptoms, can we check that is she dealing with postpartum depression? And this is really helpful, which I share with moms. This is the scoring key, which will help them to check. First, the question, I'll go through only few questions. Does she seem persistently sad, teary, or emotionally low without a clear reason? Now, you can rate no, not at all, occasionally, often, or almost always. So you rate, if almost always it's 3, and when you calculate from all the questions, then you have this scoring key. Now, if the score goes above 25 to 30 points, then severe depressive episode, and immediately a woman needs professional help. And this is very important note for the family members. This is not about labeling or judging. It's about showing love through awareness. Early intervention can help a new mom heal faster. She feels supported and bond better with her baby. If you are unsure how to help, simply asking, how can I support you? And I tell it to all family members, even those who are unmarried siblings. They can go and they can ask their bhabi, how can I support you? And it's really powerful. Now, moving on to the symptoms of postpartum depression, there is a constant worry about something may happen to me or my baby, checking baby again, distortion of the reality, not focusing on what's happening right now, feeling of overwhelmed all the time, engaging in continuous thoughts and hallucinations in head. Some patients, they start talking to somebody who is not there in reality. There is anxiety, there is prolonged sadness, and there is a tendency that they isolate themselves. So family needs to take care of that. If parents are staying with them or husband is there, then they can take care that she should not isolate herself. Now, when we are talking about the causes of postpartum depression, there could be psychological causes. There is a depression history, there is a negative attitude towards life, then risky pregnancy, there is a prolonged hospitalization or C-section delivery, which maybe the mom was not expecting that she has to go through a C-section delivery. When there is no family support, there is abuse, domestic violence, smoking during pregnancy, then social media pressure, how I can be a best mom, what else I can do, comparing herself with other moms on social media. Wow, they are doing multiple jobs, they are managing their job, they are influencer, they are good moms, because they show you the good picture on social media. Unrealistic expectations from family and the society, changing in the lifestyle, sleep cycle, wrong eating habits. Now, work life imbalance and guilt. I'm not giving time to my child. I'm not giving a quality time. Quantity, she's already dealing, but there is a guilt whether I am giving quality time to my child or not. I'm missing my child all the time. She has that imbalance going on. Hormonal changes, low levels of dopamine, all happiness hormones, no exercise, sitting inside the room all the time, or if doing job, then sitting inside the office and then coming back home, no fresh air. These could be the causes. Now, when it comes to the treatment of postpartum depression, psychotherapy, CBT, cognitive behavior therapy, plays a major role. It's a talk therapy. Antidepressants are given, but with the psychiatrist's advice only. So if anybody is going for a therapy, they will go to a clinical psychologist, or some doctors also, they also does the therapy part. But antidepressant medicines are always prescribed by a registered doctor, RCI registered doctor, not taken from anywhere else. Individual therapy or group therapy, sometimes the whole family is also involved, that everybody should know what she's going through, what help she's required. And individual therapy, individual sessions where a mom goes and she takes the individual sessions. Immediate intervention with mental health professional, that is highly required. Self-care routine, which most of the moms, they forget, they don't focus on their self-care. There is no self-care routine, and that includes multiple things: reading a book, taking a bath, going out, talking to your friends, involved in some mom support groups. If you like some activities which gives you happiness, involve yourself in that. In that case, art therapy, which I does in my programs, music therapy, listening to music, talking to your friend, just like that. Just involve yourself in your normal life. Becoming a mom doesn't mean that you have to segregate yourself from the world. Now, breathing and doing simple exercise. A new mom, she cannot go out, but she can do few exercises inside the room. At least she can stand in the balcony or go on a terrace and take some fresh air, do some deep breathing exercises, take healthy diet, prepare your diet. Because when I do the sessions of manifesting postpartum, positive postpartum, there I involve that what kind of groceries you should have when you are going to deliver a baby, what all structures, powerful structures you can have at home, which will help you when you will be busy with the baby. Now create time for yourself, for your rejuvenation, for your creativity. Make time for rest and communicate with the family. Most of the time moms deal with this, that how to communicate it to the family, that I also really need rest. That doesn't make you a selfish person. If you are not taking care of yourself, how you can take care of a baby? So I call, it's not selfish, it's self-ish. अपने आप से प्यार करना, it's highly required. Now examine breastfeeding time. How much, like if doctor has told you to breastfeed your child after 2 hours, then don't check again. Maybe whether my baby is hungry or not. So have some patience. Spend some time with your spouse, which most of the new moms they don't get time, and then they think that right now my baby requires my more attention, so I should focus on baby right now. But if you're not talking to your spouse, you're not spending time, you will feel after some time that there is a gap in our relationship, which always impacts. And a woman, when she goes into depression, this could be one of the cause. Now, as I told you, breathing exercises, it is highly recommended, which can be done from balcony or sitting near the window, doing journaling. Now, in journaling, you don't require all the prompts. Whatever is there in your head, whatever is going on, what you are feeling right now, just write down, today I'm feeling this. This much is required. And when I went into depression, that journaling was not introduced, and I didn't know, but I had a habit of writing a diary. I had a habit of, when I'm not speaking to anyone, when I'm not expressing, and I don't find the members of my family who will understand my feelings, I always write. And that really helped me to take out thoughts and feelings which are overpowering me, to come out of my head. Virtual connection with mom community. If you can't go out, involve yourself. There are multiple groups where you can be a member of a mom community, where you will get the information. Okay, they are also going through the same phase. I am not the separate one who is dealing with these new baby blues. Challenge your negative thoughts. What's going on? When you write down, then challenge your negative thoughts. Why I am thinking about it? Is it helping me? Doing mindful meditation, which I will do after few minutes. We are going to do one mindful meditation today, and those who are in the session, they can do. Don't think that only this is for the moms. This mindful meditation can be done at any time of a day, and it is really helpful. Doing light exercises, they are always helpful. It helps you to release your happiness hormones. Now I request those who are present here, please, if you have mirror near you, if you don't have a mirror, then you can take out your mobile phones and open the camera so that you can at least see yourself in the camera. Are you ready? Can I get thumbs up if you are ready for the mindful exercise? You can give me virtual thumbs up, or I can see those who are here, they can give me thumbs up like this if you are ready for the mindful meditation.
Yes.
Battery 100%. Connected to. Geez, I found.
Find a quiet place where you can sit comfortably in front of a mirror. If you want to switch off your camera and you want to stand in front of the mirror, you can. Take a few deep breaths to center yourself and relax. Take a few more deep breaths. Now gently gaze into your own eyes in the mirror. Notice any thoughts or feelings or sensations that arise. Don't stop yourself. Let these feelings arise. I know it's difficult to look into your own eyes in the mirror, but keep doing it. Don't judge yourself. Observe your facial expressions, your body language, and the emotions that are reflected in your eyes. Ask yourself, how am I feeling in this moment? What emotions are present in your body? What thoughts are running through your mind all the time? Take a few more deep breaths. Express gratitude for this moment of self awareness and reflection. Stay in this space for a few more seconds. If you want to share, how do you feel? You can write it down in the comment box. If you couldn't do it, please watch the recording and please do this mindful exercise. It will really help you. As you know that I'm a mom coach and I'm a psychologist. I run courses for new moms. There's a course, Blooming New Mamas, where mamas bloom when they get rid of all the thoughts, all the resentment, regrets they have in their life. This is some of their sharings where they shared about what they got after the programs. If you know anyone who is dealing with multiple issues in their life, These are some glimpses of the sessions which I take. This is one-on-one session. This is a group session picture. You can share my number with them. I'll share in the later slides. These are some of the freebies which I give to all new mamas. These are the 2 ebooks. Highly recommended postpartum plan from new moms, strategies to overcome postpartum depression for new mothers. This today's session is just a part of it. The journaling workbook, all these worksheets are there where they express gratitude. Every day they practice the journaling. The mindful exercises booklet where they practice every day, they practice mindful exercise. Positive affirmations for moms. During the sessions, they read their positive affirmations, which help them to keep their mind sound. This is the art therapy, which I does in my program. It's a 5-week hand-holding program. If you want to take a screenshot of it, you can share it with somebody who really require it. And this whole program has been created with my full experiences. I really want to contribute in new mother's life. That's why I created this wonderful program. If you have any question, you can ask. If you want to ask something, I want to express my gratitude. That thank you so much for being here, for attending the whole session, staying till the end. And these are my social media links, geetachopra.official, Geeta Chopra Mom Coach. If you want to follow me, you can follow me on Instagram. These are my numbers. Hi, Gurmeet, you are drawing something. I hope that this session has given some glimpse of postpartum depression. If anyone who is dealing with this type of situation, you can support them. And if you haven't joined the session on time, please watch the recording and do the mindful exercise. I request even those who are not dealing with postpartum depression, but they can do mindful exercise. Thank you so much for being here.
Geeta. Yeah. Does anyone has any question?
Yeah, if you have any question, we can stay for more.
Sat Sri Akal, Geeta.
Hi, Sat Sri Akal, Gurmeet.
And I feel that you have covered everything because I'm a laughter yoga trainer and trainer for Maven as well. So laughter yoga helps with postpartum depression, especially new mothers and mothers who are in the womb still inside. It really helps. And I actually support this very, very, very much. So well done, Geeta. And I hope that you can have part 2 of this session. Thank you.
Thank you. Thank you, Rajveen. And see, you like the session and you know the depth of how it is important. Many women, they suffer. Many women can't speak. But if we are there to support them, if only few people are there to support them, they can at least start speaking out. At least they can say, okay, I need support. There is someone who can understand what I'm going through. So thank you, Rajdeep. Thank you, Gurmeet. I got it. And I would love to conduct more sessions.
I
and
think
I'll
Kuldeep
share.
ji has question. Kuldeep ji, do you want to share?
Yes, actually, I couldn't attend it from the beginning,
Okay.
and I have already attended some sessions of Ravin Kaur from India. I am from India, Delhi. So actually, Geeta ji, you were saying that if you have not attended and you want more, uh, then I may ask you. How can I get its recording then? Today's session.
You want to like you haven't attended, so the recording will be shared in the group.
And
Uh,
it is also on the Maven Magic YouTube channel. The recording is there on the
YouTube
YouTube.
channel.
Yeah.
Yes. You can you tell me the name of the on YouTube?
Yes. At
Uh,
Maven Magic. If you'll type at Maven Magic. Yeah.
okay, that I know. Maven Magic.
I'll just type it here so you can.
Yes.
Yeah. Are you there in the group, Kuldeep sir?
I can't say that I am in the group because sometimes you can add me in your WhatsApp group.
I'll share the link right now. If it is possible for you, you just take the screenshot of it, so that you have the actual link of the Maven YouTube channel.
And Maven YouTube channel. Okay.
Yeah, because we all are connected on a consciously positive group.
Okay.
So
You
there
can
is
share.
there is a YouTube channel of Maven Magic. So
Yes.
you get all the recordings. Shabana, I'm just trying to find it out. Can you just share the link of?
I have shared in the chat box.
You have already shared. Okay, I was just looking at it.
Okay.
Thank you so much, sir. If you can just copy paste it, and you can just watch it and subscribe it, so that you will get all the recordings, and it's already there. Like, it's a live
Okay.
program, so it's already recorded.
Sure. Okay.
Okay, thank you so much, everyone, for being
Thank you.
here. It was nice sharing this knowledge with all of you. I hope this session will help, even if one mom, then my purpose is solved. Thank you so much.
Thank you so much, Kira. Thank
Thank
you,
you.
everyone.